Superintendent Guerra, I am so excited to run into you. My name is Bella. I work as a substitute teacher within the special education department across all Portland Public Schools. I am also a nursing student at OHSU with a background in psychology, currently researching how schools can identify and support their most vulnerable students to ultimately impact lifetimes and generations of health outcomes. I understand that PPS is in a relatively new partnership with Multnomah Education Service District to provide behavioral health resources to students, but these efforts are mostly focused on middle school and high schools. Evidence-based practice suggests that treating mental health problems after they develop is much more difficult and costly than implementing harm reduction strategies the moment that student steps foot in kindergarten. I know firsthand that the elementary schools in this district are struggling to provide safe academic environments to students that struggle with behavioral issues. Young students with rule-breaking patterns are taken out of their normal classrooms to be babysat by well-meaning but poorly equipped educators in roles with turnover rates that are never longer than one school year. At some elementary schools, students are sent home to angry parents for behavioral rule violations. Still more confusing is how students with behavioral issues are being sorted into special education classrooms, cutting into already low special ed resources when really what they need is compassionate behavioral health support. You have done a phenomenal job at promoting your mission toward racial equity and social justice. My idea for this problem aligns with these same values. So every school already has at least one school nurse. Let's equip these nurses with the tools to screen for behavioral health related problems during their regular student health assessments. Nurses are acutely aware that physical and mental health cannot be separated. From there, we can provide behavioral health interventions specific to each child's unique situation and measure the efficacy of each intervention. Data is already collected on measures such as school attendance, grades, and income level. These data points together provide a bigger picture. If we do not make an integrated effort to understand this bigger picture of life for each student, then we are letting kids fall through the cracks. We are telling them that we only care about their health when it's a problem for us as school employees. I know this was a lot of information and I really appreciate your time. I'm willing to contribute to these efforts so long as I have your support. You'll be able to find my email in the school directory. Please let me know if you have any other questions. Thank you so much.